Hey, this is Emalani Massage Therapy coming to you again with another video for the migraine and headache series that we're doing, and this is video number 5. We're going to be talking about the TMJ as well as a little bit more into that soft palate and the back of the neck. So last time we covered the jaw, the masseter, and that sinus area in the cheek. And what we're going to talk about is a TMJ. If you've not heard of it, it's that tiny little bit of muscle and a tiny little bit of ligament that sits right between your jaw and your skull. And it's that hinge that lets you open and close your mouth. People who have lockjaw, who have had their jaw pop or any kind of grinding issues, may feel pressure or discomfort right here in front of the ear. And that's about where the TMJ sits. And what happens when you're having any issues with lockjaw, or you're having issues with that grinding and pressure with your teeth, is that you're using your masseter to pull up really hard, and this over here, this small little muscle and this small little ligament tend to get irritated and they stop moving properly. This is a very sensitive area, so similar to the eyes and similar to the soft palate, you want to go gentle here. You don't want to go in with all the pressure you have right away. You want to start lightly just palpating and feeling for it and seeing what it feels like to poke that area. If it's very tender and it's uncomfortable, then don't put a lot of pressure into it. Don't bother it. So you can feel right about in front of the ear. There's going to be a little spot, and when you open and close your mouth, you'll feel it moving. You'll feel that bone shifting. So put your hand there gently, and then open and close your jaw and see if you're in the right place. So you can kind of see a little bit of that movement. All right, so you're right in the right place. We're doing small little circular frictions. With the jaw or anything on the face, it's a good idea to be working on both sides at the same time if it's comfortable, because that way you're not pushing it off, you're not rotating your jaw out of place while you're working on it, because a little bit of pressure can make a big difference when it comes to your jaw and that TMJ. Do little circular frictions. And again, when you're working along that jawline, when you're working in the masseter and the cheek, that can also go into that TMJ area, and you can just pause there for a minute as you go over it. And you can just do a pin, and you can do the opening and closing of your jaw again, and you can see how that feels. Alright, so you kind of feel right there. You can do the little small circular frictions. You can do a little bit of that downward pull because you're pulling on the fascial layers around it as well. You can get a little bit behind, that's the back of the jawbone. You can kind of do that little pin and stretch with the thumb and the side of your knuckle. Do a little bit of that, and you're mostly getting into that fascial area, into the skin. So you're not really pulling directly on that muscle so much as you're releasing and relaxing the structures around it. So you're going to pull down on both sides, just gently. You can do those circular frictions. And you can move along that jawline a little bit back into that soft palate as well. These are the muscles and the fascial and skin layers that affect it as well. So you're relaxing that whole line of tension along the face. And do a little round there and come back up to that, a TMJ. Alright, so it's, again, you're going to go very soft and very gentle, and you can build up to a little bit more pressure if you find that you need it, but you can start off small. You don't want to overdo it because it's such a small area, just a little spot here where your jaw hinges at. So go gentle, try to keep it nice and even so that you're not pushing your jaw out of place, and be nice to yourself. Do a little bit of that work at a time. Don't spend hours on the same spot. So move around, get those surrounding structures as well, and we'll see you in the next video.